socio-economic sciences and humanities integration in all Horizon 2020 program, with a specific focus in the health topics. This is the agenda of today. We'll start with an SSH integration introduction. We'll try to identify and to explain the reasons for SSH integration in Horizon 2020 and in the health work program. We'll try to explain also the SSH integration process with all its relevant steps. We'll provide you with some best practices examples of very successful projects that include and integrate SSH aspects, and we'll provide you with some data on the first calls 2014, always focusing on the socio-economic sciences and humanities integration in Horizon 2020. So, let's start with a short introduction on the SSH integration, and but I would like to start with some definitions from the health world. So I'd like to start with this definition provided by the World Health Organization on health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So in this definition, we can identify that the physical aspects are very important when we are talking about health, but not only the physical and medical aspects, but also mental, social aspects and well-being are relevant and essential part of health. Let's see that the specific objective of the societal challenge number 1, health, demographic change and well-being, is to improve, in Horizon 2020, is to improve the lifelong health and well-being of all. So again, the well-being, not only the medical aspects of health. So let's see in the more specific activities related to this specific objective that lifelong health and well-being is for all children, adults and older people, and the aim is to provide high quality, economically sustainable and innovative health and care systems as part of welfare systems. And these are all aspects that made up of health, the health concept. So health is something not only medical, not only physical, but also related to society, to social aspects, to psychological aspects, to behavioral aspects. Again, with health, we can see that in the work program 2016-2017, the overall strategic orientation of this societal challenge number 1, health, demographic change and well-being, is promoting healthy aging and personalized healthcare through several research priorities and activities: personalized medicine, mental health, patient empowerment, active and healthy aging, valorization of people, maternal and child health. All these aspects are a mix of a lot of socioeconomic aspects, and with these strategic objectives, with these definitions, we can understand that health is not medical, is not physical, but it's also a social issue. And in order to personalize medicine, that is the aim of the work program 2016-2017 of the societal challenge number 1, we need to carry out to consider not only medical but also psychological, social, sociological aspects, to offer the best and most customized services to our clients, to our patients. So, this is an introduction starting from health, to let you know, to let you understand that health is very close to society, health is very close to the socio-economic sciences and humanities. So, what about the SSH integration? What is it? The social sciences and humanities research are some aspects of the research that will be fully integrated into each of the priorities of Horizon 2020 and in each of its specific objectives. so that the socio-economic sciences and humanities can make a contribution wherever they are needed. This is the definition of the socio-economic sciences and humanities provided by the framework regulation of Horizon 2020. So in Horizon 2020, we'll find the socio-economic sciences and humanities fully integrated in each part of the program. In the FP7, we used to have a standing alone program called Socio-economic Sciences and Humanities. That was something that used to work independently, not together with other disciplines. Right now, with the Horizon 2020 program, we find that the Socio-economic Sciences and Humanities, the acronym is again SSH, is a cross-cutting issue. Transdisciplinarity is a fully integrated part of the evaluation criteria of each proposal submitted for Horizon 2020. And the mandatory issue is to work together to integrate the socio-economic sciences and humanities in each part of Horizon 2020. Again, maybe many of you can recognize here the full structure of Horizon 2020, the three main pillars: excellent science, industrial leadership, and societal challenges, and the other parts of Horizon 2020. The socio-economic sciences and humanities are in each part of the program, fully integrated in each part, not only in the societal challenges, but also in the industrial leadership, but also in the European Research Council and in Marie Skłodowska co-reactions, everywhere in the program. So, this was a brief introduction, only to let you understand better what we mean when we talk about the SSH integration, the socio-economic sciences and humanities integration. Now we're trying to understand the reasons for this integration, why we need it. Why are the SSH disciplines integrated in Horizon 2020? First of all, I would like to introduce you the two acronyms that you can see here in this slide. The SSH disciplines, now you know what it means, socio-economic sciences and humanities disciplines. But you have also the STEM disciplines: science, technology, engineering, and mathematics. So the other world, the other side of the research. So the STEM disciplines and the SSH disciplines must work together to reach and to face the complex societal issues that are the basis of Horizon 2020. So through the integration of the socio-economic sciences and humanities, you can reach solutions and products that are socially acceptable, directly applicable in the market, marketable and cost-effective. So a lot of positive advantages for the society. If you want to carry out a research in the ICT field, and you want to provide to have this final product of your research and to put it in the society among people, and to let people accept this product, you need to consider also other aspects, also social, sociological, behavioral, psychological aspects, economic aspects, a lot of aspects that are not properly within the STEM disciplines, that are not science, technology, engineering, and mathematics, but that require also other aspects of research, and namely the socio-economic sciences and humanities, to face complex and societal issues. So the SSH aspects include, for example, the human behavior and choices, lifestyles, and well-being, for example, and also human geography and demographic trends, historical considerations, economic analysis and business models, legal, institutional, and political frameworks, variations across social groups, cultural and anthropological aspects, and the social innovation. This is not an exhaustive list. These are the most common SSH aspects that you can find, that you can face within the topics in Horizon 2020. And in particular, I'd like to highlight that for you, from the health world, the human behavior, the choices, the lifestyles, the well-being, the human geography and demographic trends, the economic analysis, the social innovation, the variations across social groups are all very relevant and fundamental aspects for your researches. And I think that this is quite obvious if you are interested in something that is medical and that is for society, that is for patients, and the patient is a person, a human person, and you need to consider not only the physical and medical parts of this person, but also all the social, sociological, psychological aspects of this person. Why do I need, as researcher, as health researcher, to integrate SSH, Socio-economic Sciences and Humanities, in my proposals? Why? Which are the real reasons for the integration? First of all, because Socio-economic Sciences and Humanities experts are called by the EC to contribute through, for example, the advisory board in writing the work programs. So in each topic that you can find in Horizon 2020, you can find the influence also of the Socio-economic Sciences and Humanities experts. If you are facing a topic, you are in front of a topic that involves SSH aspects, you are in front of a flagged SSH topic. The European Commission decided to provide the topic relevant for Socio-economic Sciences and Humanities with this label, flagged SSH topic. When you hear or when you read flagged SSH topic, you know that this topic is relevant, is near to the Socio-economic Sciences and Humanities. Flagged SSH topic. This is something that is very common in the EC documents that we can find also during this presentation. When you submit a proposal for a topic that is considered as flagged SSH, you need to consider SSH aspects, of course, within your proposal. And when you submit the proposal will be evaluated by evaluators selected by the Commission. And the evaluation panels of evaluators that evaluate your proposals include SSH experts. Also, if you are submitting a proposal for a topic taken from the health work program, and this topic is flagged SSH, so it's relevant, near to the Socio-economic Sciences and Humanities, you need to include SSH aspects because the evaluators will look for them. Because if this is a flag topic, an SSH flag topic, you must include SSH aspects in your proposal. Otherwise, the evaluation cannot be successful. Here you can find some examples of the evaluation summary report taken from some proposals. Some are good, some are bad, then some negative examples. The evaluation summary report is the report that the Commission provides to the coordinators, and that where you can find all the comments provided by the evaluators, divided in 3 criteria: excellence, impact, and implementation. Here you have the first example, the first good practice for the criterion number 1, excellence. You can see that this evaluation summary report was for the topic PHC1, Personalized Health and Care 1, 2014, the one related to the determinants of diseases. So here in the comments that you can read and that I have underlined for you, the coordinator and the consortium stressed the social determinants of health. They stressed also that social science the social science in the context of rising attention in society and political fora with respect to increasing socioeconomic inequalities. So, to involve a wide range of disciplines to carry out this research. You can see and you can easily understand that these comments are positive because in this proposal, in the excellence part, the consortium included SSH aspects, socioeconomic sciences and humanities aspects. They considered them. This is another example for the criterion number 2, impacts, another good practice. And as you can see, always in the parts that I have underlined for you, the evaluator suggested that the results of this research will underpin socioeconomic programs, for example, access to appropriate care, social and health insurance, retirement age at national level and at EU level. And again, this research brings together a wide range of stakeholders from different disciplines, policymakers, healthcare professionals, social agents, and enterprises, among others. So again, you can see that in the impact, the consortium stressed the mix between the STEM, the science, technology, engineering, and mathematics research, together with the socioeconomic sciences and humanities disciplines. And the results will carry positive impacts on society and on the socioeconomic programs. Here you have the final good practice taken from the criterion number 3, quality and efficiency of the implementation. In this part, I underlined the section, the comments from the evaluators on the consortium. In the section dedicated to the consortium, this proposal was very good because they stressed the fact that the transdisciplinary, so the involvement on different disciplines coming from STEM, science, technology, engineering, mathematics fields, but also from socioeconomic sciences and humanities fields, allowed to carry out this research to reach great impacts and to have a very successful consortium. So these are all some criteria and comments for a flagged SSH topic. Because when you are facing an SSH flag topic, you need to involve SSH aspects because the evaluators will analyze them. But there are also bad practice, not only best practice. And in this case, for example, for the criterion number 1, excellence, in this proposal, the evaluators highlighted some strengths, but also some weaknesses. And as you can see in the weaknesses, you have the transdisciplinary considerations are limited. So this is a bad characteristic of this proposal, because if you lack transdisciplinary in your proposal for a topic that is considered by the European Commission as flagged SSH, so relevant for the socioeconomic sciences and humanities, because you need to carry out researches that are near to society, and you don't consider the transdisciplinarity, you don't include in your consortium SSH aspects, SSH institutions, you cannot carry out this research in a positive way, not in the way that the Commission wants. So this is the problem of this proposal, a bad practice. Another bad practice, again for the excellence criterion, I underlined for you, the transdisciplinary considerations are not sufficiently included in the proposal. And again, the lack of transdisciplinarity for a topic that is flagged SSH, so it's identified by the Commission as relevant for the socioeconomic sciences and humanities, this characteristic of this proposal can carry you to a very low score. And in this case, the score is 3.50 for the excellence, not enough to be successful. And again, the last bad practice from another evaluation summary report for the criterion number 1, excellence. In this case, the problem was the lack of an economic perspective. So when we are talking about economics, we are talking about socio-economic sciences and humanities. And if the topic requires economic analysis and you miss this part in the proposal, your score will be low, of course. So these were some examples of evaluation. So only to let you know, to let you understand that the Commission put a lot of interest and a lot of attention in the integration of the socio-economic sciences and humanities. Well, let's move to the SSH, the Socio-Economic Sciences and Humanities integration process. We can start in this way to analyze, to see this picture that is made up of four different steps that are part of the integration process within your proposals. Because it's so relevant that you consider for SSH flagged topics the socio-economic sciences and humanities, but it's not easy. I can understand this. The Commission can understand this. So we are trying to identify the process for this integration of SSH and how to include all these aspects within your proposals. So let's start with the topic analysis, the first step. When you are interested in a topic, of course, you need to read the topic, the text of the text of the topic. So when you are reading a topic, especially in health, in the health sector, that is so near to society, maybe you can face an SSH flagged topic. So you need to be aware that it can be an SSH flagged topic. How to do this? When you read the topic, you'll face a specific terminology, and you need to identify if this topic is relevant for SSH, for the socio-economic sciences and humanities, or if this topic is dedicated to the socio-economic sciences and humanities. So if the topic is relevant for the socio-economic sciences and humanities, this means that you need to consider multidisciplinary aspects within your proposals. You need to mix STEM and SSH disciplines within your proposals, and also to involve both STEM and SSH partners in your consortium. So again, socio-economic sciences and humanities and science, technology, engineering, and mathematics must work together to reach the results for this topic. If the topic is dedicated to SSH, the topic will be focused only on the socio-economic sciences and humanities. But as we are talking about health, it's quite impossible that the topic is only dedicated to socio-economic sciences and humanities. So what you'll face in the topics probably will be relevant topics, not dedicated topics. So you need to consider if the topic that you are facing is a relevant topic for SSH, that you need to mix both STEM and SSH. How to assign the SSH flagged? Yes or no? Is it an SSH flagged topic or not? How can I understand this? You need to consider two things, two aspects. First of all, the terminology. If in the topic you can identify socio-economic sciences and humanities terminology, this is probably an SSH flag topic. Otherwise, not. Otherwise, the topic will be only focused to STEM research, to science, technology, engineering, and mathematics. The second aspect that you need to consider is the consortium. So will the consortium require SSH partners to adequately and comprehensively address the issue at stake? So do you need to include partners from the SSH disciplines to carry out the activities for the topic? Yes or not? If yes, you are facing an SSH flag topic, otherwise no. This was the first step, the topic analysis, the first topic analysis, the first reading that you can do of the topic. The second step is the identification of SSH terminology. Here you have, I don't know if you can read it, but it's one topic taken from the Work Program 2016-2017 of the Societal Challenge number 1. And this topic, I have highlighted for you the SSH terminology in this topic, because this topic, that is one topic of this Work Program 2016-2017, and it's the number 4, the PM Personalized Medicine for 2016. This topic is flagged for SSH. So I highlighted for you, I underlined for you the SSH terminology, the socio-economic sciences terminology that can make you understand this flag for this topic. So first of all, occupational, societal, and lifestyle determinants are expressed in the topics, are required in these topics, and occupational, societal, and lifestyle determinants are something not medical, but are something from the SSH world, from the sociological aspects, psychological aspects, behavioral aspects. Again, social platforms. When you see social platforms, of course, you need to consider also the social aspects and the sociological aspects. There is again a reference to socio-economic research in this topic. So, of course, this topic is relevant for the socio-economic sciences and humanities. And in the end, in the impact, you have the economic evaluation. That is again a socio-economic sciences and humanities aspects. So this is the terminology taken from this topic that is a flagged topic. The flagged topic are the topic relevant or dedicated to the socio-economic sciences and humanities. And in this case, this topic will be a relevant topic with a mix between socio-economic sciences and humanities disciplines and between science, technology, engineering, and mathematics disciplines. So the consortium will need to identify both SSH partners, but also medical partners, and to identify activities that mix together STEM and SSH aspects, medical and socioeconomic and humanities aspects, to reach and to fulfill the requirements of the topic. Sorry. This is another example, again taken from the Work Program 2016-2017 of the Societal Challenge number 1. The topic is the number 7, Personalized Medicine 7, 2017, with a deadline in 2017, promoting mental health and well-being in the young. So this is a very complex topic, and again, I highlighted for you the SSH terminology for this topic. Again, this topic is a topic SSH flagged. For the Commission, it's not something that I tell you now only to tell something, but it's something that is recognized by the Commission. So this topic, again, has SSH terminology. Behavioral disorders, risk of social exclusion, educational, social, and economic outcomes, psychological, family, and social factors, societal, cultural, work-life, lifestyle, economic perspectives, and reducing inequalities. All these terms, all these words are relevant for the socioeconomic sciences and humanities, of course. So again, you need to choose if this is a flag topic or not, and this is a flag topic because you have all this terminology, and as this is a flag topic, you need to choose between a dedicated topic or a relevant topic. Of course, it's a relevant topic, because here you need to mix, again, the socioeconomic sciences aspects, but also the medical aspects coming from medicine, and carry out the research together between SSH and STEM. Here you can find a piece of terminology in general taken from the work program 2016-2017 for health, for the health sector. And this is like a vademecum for you that you can use to read or to reanalyze the topic that are interesting for you. And you can use this terminology to help you in identifying if this topic is if the topic is relevant for you for SSH or not. So for example, when you read, when you hear profile user, consumer habits and patterns, identify key drivers and influencers of their choices, the choices of patients, of people, assess self-images of users, investigate the roots of resistive behavior, identify distorted perceptions and create counter-narratives to address them. And again, for example, occupational, social, and lifestyle determinants of diseases, health economics and health inequalities, behavioral disorders, social exclusion, mental well-being, psychological factors, social and economic impacts. All these terms are coming from the SSH integration terminology. And when you find some of these aspects, some of these words in your topic, in the topic that is interesting for you, you are in front of an SSH flag topic. But this is something not so easy to do if you are not common with these aspects, with these analyses. So is there a document or a tool that can help you in this process? Yes, there is, and this is the Socio-economic Sciences and Humanities Opportunities document that is published by the Net for Society project, that is the network of the socio-economics of the National Contact Point for the Societal Challenge number 6, and I am one of the three Italian NCP for the Societal Challenge number 6 in Horizon 2020, and you can find at the link that you have here in the slide this document. This document is a vademecum for all the researchers to identify the flagged topics for SSH. And here you have all the parts of Horizon 2020. So you have also the first societal challenge with all the topics that are flagged for SSH. And you have the test, you can find the test of the topic that is underlined in bold in all the SSH terminology, in all the SSH parts. So you can have, like in the previous slide, the test of the topic with in bold the SSH relevant part. This can help you in this process of identification of SSH relevant topics. And here I put for you all the topics that you can find, that you'll find in the document, in the opportunities document for the Societal Challenge number 1, for, of course, Work Program 2016-2017, as identified by Net for Society, of course, with the support of the European Commission. And here you have these topics, and all these topics are relevant and have like SSH terminology in their tests. So if you are interested in one of these topics, you must be aware that these topics are relevant for SSH. So you'll need to consider SSH aspects. Let's move to the third step, the identification of relevant disciplines and the right partners, the identification of right partners. Of course, the first step, topic analysis, the first reading of the topics. The second step is the identification of the socio-economic sciences terminology. You need to understand if the topic is flagged for SSH or not. If the topic is flagged for SSH, of course, you need to identify the relevant disciplines from the socio-economic sciences and humanities to involve in the consortium and the right partners. Well, this is an example for you. I've taken the terminology of one of the previous topics, again, behavioral disorders, risk of social exclusion, educational, social, and economic outcomes, psychological, family and social factors, societal, cultural, work, lifestyle, economic perspectives, and reducing inequalities. All these are SSH terms. This is an SSH terminology. But which are the disciplines that are related to this terminology? On the right side of the slide, you have the answer to this question. Psychology, sociology, social innovation, anthropology, social aspects, economics, and education are all the disciplines that you need to consider in to fulfill with the request of the topic. To reach all these aspects that are in the SSH terminology. Of course, in your consortium, there will be not only these disciplines, but also all the medical part of the consortium. But to reach fully, in a full way, the topic and the scope of the topic, the impact of the topic requested and required by the topic, you need to involve also all these disciplines. You need to consider SSH researchers. You need to involve and to include, to contact SSH institutions. And within your proposal, you need to include these aspects. Now you need to find the right partners, because if you need someone, a researcher from psychology, or I don't know, or an economist, for example, you need to look for this person, for this researcher, and where you can find all this information, all these contacts. If you are a researcher from health, and you are interested, you need an SSH researcher, you can check in the research directory. That is a database of profiles authored by the Net for Society project, and here you have the link. And in this database, you can find more than 1,000 SSH researchers' profiles. So, if you are interested in an economist, you can look for someone from this specific research field on this research directory, and here you have all the profiles divided per country. If you are a researcher from the SSH world, from the socio-economic sciences and humanities, but you are interested in health topics, of course you can check the partner search tool provided by Fit for Health. That is the most official platform for partner search for health that we have for Horizon 2020. And here you can look for the proposal, the profile that you are looking for. And otherwise, if you have a problem with the partner search tools, of course you can contact your NCPs or for your national contact point, both for Societal Challenge number 1 and for Societal Challenge number 6. Let's move to the fourth step. Integrate SSH in your proposal. So, you need to integrate the socio-economic sciences and humanities in all the topics, in all the proposals for topics considered as socio-economic sciences and humanities flagged. So you have you can do the analysis by yourself or with the support of the opportunities document that I've shown you previously, but you need to do this. You need to identify the disciplines, the terminology, and the right partners to be involved in your proposal. And you need to integrate the socio-economic sciences and humanities in each part of your proposal, in the excellence, in the impact, and the implementation, and also in the activities. Something that happens very, very often is that in a topic that is flagged for SSH, you can see like a sentence at the end of the excellence part, where the consortium says that all the socio-economic sciences and humanities aspects will be considered. Only a sentence. But this is not enough, of course, because you need to explain to the evaluators and to the Commission that you are really taking into consideration the socioeconomic sciences and humanities if the topic is flagged for socioeconomic sciences and humanities. So you need to include all the SSH aspects in the excellence part, in the impact part, but also in the work packages, description, in the task, leaderships, and in the deliverables, for example, in the description of the activities that you carried out with your project. This is something that must be very clear for the evaluators, because they need to understand this very clearly. The second step, you need to integrate socioeconomic sciences researchers and institutions in your consortium. And you need to cover all the disciplines identified in the topic with the right partners. And you have a lot of tools to identify the right partners coming from the socioeconomic sciences and humanities world. The third step is the budget. Don't forget the budget, please. You need to assign an adequate budget to both STEM and SSH partners. So you cannot think that the SSH part is only the communication task. With 10 persons a month out of 400 persons a month of all the proposal. It's not a successful choice for you, because if the topic is flagged for SSH, you need to consider the socioeconomic sciences and humanities aspects in excellence, impact, implementation, in all the activities, in the partnership, in the consortium, and also in the budget. Assigning an adequate budget to all partners. Here you have some pieces of the proposal templates, and here you have the first criterion, excellence, and I highlighted for you, underlined for you, a section where you need to express strongly the integration of SSH if you are interested in a topic that is flagged for the socioeconomic sciences and humanities. And as you can read here, you need to identify any interdisciplinary considerations. If your topic is a flagged SSH topic, your topic is a topic which requires interdisciplinarity, multidisciplinarity. And here you need to express and to explain how this interdisciplinarity is carried out is reached by the consortium and the activities of the project. And here you have, for example, the section in the implementation dedicated to the consortium as a whole. And here again, you need to express, to explain how the expertise of all members of the consortium complement one another. So here you need again to express and to explain the multidisciplinarity of your proposal. How are you involving all the disciplines required by the topic? You need to be very, very clear in this section. Here you have a guide provided by the European Commission for the evaluators of the proposals, and this is available on the participant portal in the section dedicated to the reference documents that many of you probably know. And this guide is very helpful to identify the relevant aspects. And here you have an explanation of the flagged SSH idea. What is a flagged SSH topic? What does it mean? And again, the relevance of the socioeconomic sciences and humanities for these topics. And this is a very useful document that you have, and it's free, is on the participant portal and very useful. Let's see some best practice examples. So all this theoretical speech discussion is, I can understand that it's not so easy to understand all these parts, all these aspects, all these steps, but we can try to understand with some best practices, examples of some successful projects funded in the 2014 topics, that this is something that is feasible and that the results of these projects are very interesting, more interesting than the results coming from a project that is not considering the socioeconomic sciences and humanities aspects. The first example is the LifePath project. LifePath, the acronym, is for Life Course Pathways Underlying Social Differences in Healthy Aging. So the aim of this project is to analyze and to study the social differences that are determinant for healthy aging. So this project was for the topic Personal Health Care 1/2014, Understanding Health, Aging and Disease, Determinants, Risk Factors and Pathways, a Research and Innovation Action. On the right side of the slide, you have a brief description of the project, and you can see in the red parts are the parts that are relevant for the socioeconomic sciences and humanities. And as you can read here, there is a focus on the socioeconomic groups analysis, and the approach of this project is a positive approach for an SSH flag topic. LifePath integrates biology, biostatistics, epidemiology, epigenomics approaches with social science approaches, sociology, economics, and public health policies. This is something that is public on the web, and here you have the link to the project. And this is a typical example of a successful example of integration of the socioeconomic sciences and humanities. Because this project wants to analyze, to investigate the consequences of the current economic recessions and all the social inequalities that can impact on health and the biology of aging. So the age, the active and healthy aging is, you know, better than me, of course, that this is a very fundamental aspect for health in Horizon 2020. And here you can understand that mixing both medical aspects, but also social and sociological analysis, and considering also the socioeconomic aspect, you can have a best and a successful example of the integration of the socioeconomic sciences and humanities. Here you have, these are the work packages of the LifePath project. And you have, for example, the work package number 2, where there is a strong focus on the socioeconomic differentials. So the analysis of the project is focusing on socioeconomic aspects. To carry out an analysis like this, you need to involve, of course, socioeconomic experts, not only medical experts or hospitals. It's not feasible, of course. You need to involve also this expertise, not only, but also. And again, in the work package number 3, life course socioeconomic pathways are again something related to the socioeconomic aspects. And in the work package number 6, challenges in the SES is for socio-economic status. And again, the work package number 7, conceptual integration of the socio-economic status. So these are the relevant, the most integrated work packages with SSH. Not all the work packages are dedicated to the socioeconomic sciences and humanities. There is a mix. There is a good example of integration. Here you have another example, the Atlas project, again for the same topic, the PHC 1/2014, and the title is Aging Trajectories of Health, Longitudinal Opportunities and Synergies. And here you can see in the right part of the slide, the experts of this project come from the areas of demography, sociology, clinical medicine, epidemiology and public health, health statistics and economics, and etc. Psychology, sociology, social policy, social sustainability, demography, and economy are the socio-economic sciences and humanities disciplines identified for this project. And again, this project integrates both the medical and physical aspects together with the socioeconomic aspects. And it's a successful example because it's a project that has been funded by the European Commission. Here you have the last example, the Grow Me Up project. Again, a research and innovation action, this time for another topic, the Personal Healthcare 19-2014, Advancing Active and Healthy Aging with ICT, Service Robotics within Assisted Living Environments. And here you can see on the right part of the slide, the Grow Me Up project aims to provide an answer to the demographic change challenge by providing an affordable service robotics system able to learn the older person's needs and habits. So here you can see the ICT word, the medical word, and again the sociological aspects, the behavioral aspects that must be considered to carry out the activities of this project. And here the disciplines, the socioeconomic sciences and humanities disciplines are behavioral science, social sciences, elderly care, and support. And here you have the link to the project. Also, this is a successful example of integration of the socioeconomic sciences and humanities. Okay, I really hope that I have transferred you some piece of information that can be relevant for your activity in writing proposals, in giving and providing assistance to researchers. Now I'd like to give you some data on the first calls 2014 for Horizon 2020. These data are from is from the monitoring report published by the European Commission on the topics 2014, and it's a monitoring report on the integration of the socioeconomic sciences and humanities. And in this report you can find these figures, these data. In 2014, 236 million euros have been awarded to the socioeconomic sciences and humanities partners. And the 26% of Consortia partners in projects funded under the socioeconomic sciences and humanities flagged topics have SSH expertise. The full amount of topic that is flagged for the socioeconomic sciences and humanities in the Work Programme 2016-2017 is 41% in 2016-2017 out of 37% in 2014-2015. So the Commission has decided, after the first analysis, to increase the number of the SSH flag topics in 2016-2017. And the quality of integration of the SSH aspects in the Work Programme 2016-2017 has been further improved. So you can find more topics SSH flagged in these topics 2016-2017, and the attention given to these aspects is higher by the Commission. This is the indicator used by the Commission to make this analysis, to evaluate the SSH integration in the first topics 2014. And this indicator aggregates four different aspects. The share of the socioeconomic sciences and humanities partners that must be higher than 10%. The budget going to SSH is higher than 10%. The contributions from the socioeconomic sciences and humanities are well integrated in project abstract, keywords, work packages, and deliverables, and the contribution from the socioeconomic sciences and humanities came from at least 2 distinct SSH disciplines. These 4 aspects are the aspects that are part of this indicator used by the Commission to evaluate the integration. And the integration can be known, so no threshold was met for any of the 4 dimensions. Weak, only one dimension has been reached, has been met. Fair, threshold met for 2 or 3 dimensions. And good, threshold met for all 4 dimensions. So why do I have decided to put this indicator here? Because you can use it to help you in the analysis of your proposal. When you are building your proposals, when you are building your partnership, you can use this indicator to consider all these 4 aspects. Am I considering the SSH partners? Am I considering the budget for the socio-economic sciences and humanities partners? Have I integrated enough in the text of the proposal, in the project abstract keywords or packages and deliverables, the socio-economic sciences and humanities aspects? And the contribution from the SSH is enough, come from at least 2 distinct SSH disciplines. These are analysis, the analysis and the considerations that you need to do when you are writing a proposal for an SSH flagged topic. This graph shows the rate of the SSH flagged topic for 2014-2015 work program. The overall rate was 37% of all topics of all Horizon 2020 were flagged for the socio-economic sciences and humanities. So relevant or dedicated to the socio-economic sciences and humanities. For the societal challenge number 1, the amount is about 32% of all the topics of the societal challenge number 1. In this slide, you can see some data on the integration of SSH in 2016-2017 work program. And you can see that the rate has increased. 41% of topics, of all the topics 2016-2017 are flagged for SSH. And here you have the number of topics, total number of topics, and number of topics that are flagged for SSH. And for the societal challenge number 1, you have the total number of topics 37 and the number of SSH flagged topics 18. So in your work program for the societal challenge number 1, 2016-2017, you have an amount of 37 topics, and 18 of these 37 topics are flagged for SSH. So in 18 topics, you must consider the socio-economic sciences and humanities aspects in your proposals. Well, if you are interested in more information, of course, you can visit our website, the Net4Society website, and of course, you can contact me, Natalia Morazzo and Monique Longo, who are my colleagues from APRE, and we are the team of the Net4Society project dedicated to the SSH integration. So we are constantly in contact with the European Commission on this matter, and all the information that we can provide come from the Commission. So it's a work that we are trying to do together. So I really hope that this webinar has been interesting for you, and if you have any questions, doubts, you can ask questions here, or you can send us an email afterwards, or you can contact us in all ways, and we will be very happy to answer to your questions and doubts. Thank you very much.
Thank you, Elena, for this nice presentation. Yeah, we actually already have some questions, and I think people are typing now also. So I think I just read out the first question. Why is the organizational theory not included in relevant SSH disciplines? Is not SME or community-based service businesses an important part of well-being?
Well, this presentation is a new experiment. And it's something that we have tried to prepare for a target group that can involve both health and ELF NCPs, ELF applicants, and but also SSH researchers, and also NCPs for the societal challenge number 6. So the SSH discipline include everything. Everything that is related to organization, everything that is related to economics, everything that is related to sociology, and of course the list that I provided you was not an exhaustive list, but a list that I thought that can be interesting for an ELF audience. But in the document that you can find, the opportunities document, you have more information, of course, more comprehensive information, and not only for specific for ELF, but for each programs, for each part of Horizon 2020. And of course, this is not an exhaustive list. So don't worry. If you don't find the specific, the topic that is most interesting for you in this list, is not a problem, because the terms that I provided you are not the only the only terms, the only aspects for SSH.
Okay, thank you, Elena. And then there is one question or one comment, I should rather say, on the SSH monitoring report. So they say we should be very critical about the indicators from the SSH monitoring report. If you read it carefully, you will notice that the monitoring counts the project as SSH if it includes the words marketing or communication. And they also cite, I think, a link from Leroux. So maybe you'd like to comment on this. Elena?
Well, yeah. I'm here. I was reading the question.
Okay.
Yes. Well, I think that the first data from the first call, 2014, because the results from the 2015 are not still public for all the parts of Horizon 2020, are not so positive, unfortunately. And the Commission says that they are quite satisfied with this data, but it's a new process that has recently started. So if you think that before we had a self-standing program for the socio-economic sciences and humanities, and now you need to involve the socio-economic sciences and humanities in all their aspects, in all their complex aspects, within all the flagged SSH topics, I think that this is something very, very difficult to do and difficult to understand and to implement. So the first data are not so are not totally positive, I can say, but are the first step. And the Commission says that they can identify some problems in the evaluation process, in the writing part of the proposals, in the consideration of the proposals that must be flagged for SSH. So there are a lot of aspects to be considered, and there is a lot of work to do. That we need to do, the Commission, but also we as NCPs and we as researchers. So I think that these data are critical, but not so critical. There is room for improve our work, and I know for sure that the Commission is working to improve all the aspects that must involve the SSH integration. So starting from the advisory boards, in the definition of the work programs, until the evaluation panels. So it's something that is improving, but now we'll see the results in 2015 very soon, I hope, and we'll be able to make other considerations on this new data, on these new figures. And again, the process is evolving right now. So the Commission is working on this.
Okay, thank you. I also think from my work as an NCP, also the scientists have to get used to work together. I think this is not as easy as one might think. So, I mean, if the Commission also doesn't get any any proposals with SSH, they can flag as many topics as they want. So it's also on you to motivate people or to motivate yourself to work with SSH people or the other way around. So then the next question, is it possible to be covered all the aspects by one department of a specific institution in writing a proposal? For example, environmental and occupations issues, in other words, not including other specialists from other departments or institutions?
Well, this depends on the activities, on the institution. Probably, if you need to involve sociologists and psychologists, it's impossible to involve people from the same department, because you probably need to involve different partners from different institutions or different departments. This is depending on your proposal, on the topic, and of course on the expertise that you are looking for your activities. But you are free in building your consortium. The important thing is that you cover all the parts of the topic, or all the requests of the commission that you can read in the topic. This is the most relevant thing to do.
Okay, so then the next question, how is RRI, so Responsible Research and Innovation, related to SSH?
Well, RRI is something cross-cutting as well as SSH. So they are very near, and when you read the work program of Science Sweden for Society, that is the core work program for the RRI, you can find there a lot of SSH flag topics, because of course all the responsible research and innovation aspects are very, very near to SSH. But they are not the same issue. They are not the same thing. Because when you are talking about RRI, you are talking about ethics, gender, publication, open publication of results, and a lot of issues. But when you are talking about SSH, you are talking about disciplines. It's something different. And in the guidelines that I showed you before, the guidelines for evaluators, that guidelines are not only for SSH, but they are also for the integration of RRI in Horizon 2020 as cross-cutting issue. So there you can find the explanation of what RRI is and what SSH is, and how to integrate them. And they are, of course, near in a project, in a proposal, but not the same issue. Because you need to include SSH experts to cover socio-economic sciences and humanities research, but you need to include RRI in other considerations, when you are doing other considerations such as gender, ethics, and so on. So they are different.
Okay, thank you. And then the next question, is it just wise or is it mandatory to include SSH departments in a health-related research proposal? If mandatory, may be sufficient to include them as a subcontractor?
Well, the fact is that much often it happens that you can find in the panels of the evaluators also for a panel of evaluators that are not for the societal challenge number 6, but that are, for example, the evaluators for the societal challenge number 1, number 2, number 3. You can find among the evaluators many SSH experts. So the risk that can occur if you are not involving SSH partners is that the evaluator coming from the SSH discipline or the SSH part evaluates your proposal with a low score. And the commission, when meets the evaluators, stress the importance of interdisciplinarity and of the integration of SSH. So I can say that it's a risk not to include SSH aspects in your proposal if the topic requires this SSH, because this means that you are not covering the full topic, you are covering only part of it. And the selection of a subcontractor is something that is not related to the activity of the project, because a subcontractor can offer you a service, very specific service, that can help you in reaching a specific activity, but is not a full integration of socio-economic sciences and humanities. So you need to start with the analysis of your topic. And if you think that your topic is not a flat topic because you cannot find the relevant parts for SSH, you can go on with your only STEM, only science, medical proposal. But if the topic is flagged for SSH, it's very, very important that you involve this part to cover the full topic. This is a suggestion, of course.
Okay, so then one question. How best can an SSH team convincingly integrate STEM partners disciplines into a proposal rather than STEM being the implicit lead? Can SSH lead on any proposal?
Well, I think, if I can understand well the question, well, it depends again on the topic. If you are in front of a dedicated dedicated to SSH topic, of course, it's very common that the coordinator is an SSH institution. If the topic is very focused on the medical aspects with some minor SSH aspects, you need to consider them, but you need also to be how can I say, you need to select as coordinator the best choice. So the person, the institution, the partner with the highest level of expertise and in managing proposals, but also from a scientific aspect. So you need to do your considerations. But I think that working together, STEM and SSH, is not easy. It's something that, especially for some countries like Italy, is very, very difficult. It's very difficult also for departments in the same institution to work together. So also coming from SSH, maybe from the legal department and from the history department, there are some problems in communication. So it's not easy, but it's something that must start, and working together in front of the others, STEM from one side and SSH from the other, and talk and communicate and try to identify the best ways to integrate the activities to work together is something difficult but needed. So, well, I think that the choice of the coordinator is something that is up to the consortium, up to the activities of the project. But the work is between STEM and SSH is needed, and but I can understand, and not only me, but also the EC can understand that it's difficult, and this is the reason why it's so important to do this.
Okay, so then there's a question how to integrate SSH expertise, and people are thinking to use linked third parties to tackle SSH topics. What do you think about this?
Well, the choosing a third party, a linked third party, is something that is not depending on the activity that you need to do, but it depends on the other considerations, such as legal and institutional considerations of your own institution, of your own organization. So including a linked third party can be a good choice in some cases and can be impossible for other cases. So if you think that there is the opportunity in your consortium to include a linked third party, this is worthy, and this can add value to your proposal, why not? But it's not a general rule. This cannot be a general rule, because the linked third party is something too specific for each institution and for each organization. So it's not a common rule. You can choose it if you think that it can be a solution, a good solution for your proposal, for your consortium, or not. But it's up to you.
Okay, so then there is someone interested in criminal justice and prison, and he also left his email address. So if you'd like to contact him, you can do so. So I see a different question. I noticed there is no term in water issues. An example of topics which was mentioned in the presentation. Could you please tell us there any possibility to have a topic in water issues covering SSH and the aspects?
Well, regarding the water issues, you need to consider not the health work program, but the work program for the societal challenge number 5. And in the societal challenge number 5, there are some topics that are flagged for SSH. And in the opportunities document, you can find all the topics relevant or dedicated to the socio-economic sciences and humanities in the societal challenge number 5. So my suggestion is or to visit the document, to see the document, or to contact us afterwards to identify the best solution for you. But there are SSH flag topics not only for health, but for all the societal challenges and also for many industrial leaderships, such as nanotechnologies and ICT. So yeah, we can check.
Okay, so as I see, I think this is the last question that we got. Maybe you didn't have the time, Elena, to also look at the chat during answering all these questions. There were a lot of people typing, thank you for this brilliant presentation. It was enlightening. So I just want to give this to you again from all the participants. And thank you for your presentation and for answering all these questions. And also you, the participants, thank you for your attention. And yeah, I think with this, we're gonna end this meeting. You're gonna get the presentations and the recording. You'll find it on our website. Yeah, and with this, I wish you a nice day, rest of the day, and I'm gonna open now a link to a little feedback questionnaire, which it's only gonna take you 2 minutes, so it would be great if you could answer this to improve our services. So thank you very much.
Thank you. Thank you all for your attention.